Hi everyone, this is Dr. Praveen Patil here. Being into the medical profession, so to advise the proper diet for the proper sugar maintenance to the patient, we need to have a knowledge of the glycemic index of the food and glycemic load of the food. So whatever we have to list the food what they are taking from morning to evening, so then we'd have to try to calculate what is the glycemic load from morning to the night. Then what is the glycemic index and glycemic load of the food? So glycemic index is a fixed means if you take a jowar has a fixed glycemic index. Bit of variation will be there where they have grown it up and what is their moisture content. Very little variation will be there. And what is the glycemic load varies according to the how much quantity of the food they consume. So based on the quantity of the food they consume, based on that, so the glycemic load will keep on varying. Glycemic index is the thing, is a numerical value given to the food at what rate or how quickly it can release the glucose. So based on that it will be having the glycemic index. Then what is the standard, how they are measuring? So glucose is the standard. Glucose, how quickly it can release, no, that time period is considered as the 100. So whatever the other rest of the food, in comparison to the glucose, how quickly they are releasing the food, based on that they'll get a value. So it ranges from 0 to 100. So for example, jowar has the glycemic index of 62, watermelon has a glycemic index of 72, like that. Anything less than 55 is considered best for the diabetic patients, or even for the normal individual also. Between the 55 to 70 is the medium range, and anything more than 70 is considered as the higher glycemic index food. So small seed rice is considered as the high, means having the glycemic index of more than 70. Basmati rice has the glycemic index between the 55 to 70, and vegetables, beans, soya, etc. These are having the glycemic index less than 55. Then what is the glycemic load? Glycemic load also is calculated based on the glycemic index of the food and and the carbohydrate in the serving sample. Means how much you are taking the jowar, like 200 grams, 300, right? How much glucose it is, means carbohydrate is there in that. So multiplied by the glycemic index of the food divided by 100, then we'll get the glycemic load of the food. Glycemic load of the jowar is 13.5. So watermelon is the glycemic load is 5. So it doesn't mean that the food item which has the high glycemic index will be having the high glycemic load. It doesn't mean that, because jowar has a glycemic index of 62, watermelon has 72, but glycemic load of the jowar is 13.5, glycemic load of the watermelon is 5 or 6. So why it is so? Because based on the water content, water is more in the watermelon, hence the sugar loading capacity will come down. So hence sugar will not increase that much, even though it has a high glycemic index. That is a glycemic load. Glycemic load, anything between 0 to 10 is good, 10 to 20 is moderate, or more than 20 is a high glycemic load. Rice has a glycemic load of 25. So from morning to night, whatever food we take, we have to calculate based on the quantity, because glycemic load varies according to the quantity of the food. So based on the quantity, we have to calculate what is the glycemic load from morning to the night on the patient, and we have to cut down whether the patient is taking high glycemic load, taking means yielding food. So that kind of food we have to cut it down, and glycemic, we have to calculate the glycemic load, and it should not exceed more than 100 in a day. So if you take 100 grams of pure glucose, and the glycemic load of the 100 grams of glucose itself is 100, so altogether it should not exceed more than 100. In this way we can manage the glycemic load yielding food in diabetic patient. Hence we should have a proper knowledge of the glycemic index and glycemic load. So zero glycemic load food also are there, like meat, poultry, egg, fish, these are having very minimal glycemic load or zero glycemic load. It can be advisable to take once or twice in a week, but should not be combined with the rice, wheat, or jowar items. Okay, this is about the glycemic index and glycemic load and how we can decide the diet of the diabetic patient. If you like this video, then kindly subscribe to the channel and press the bell icon and kindly forward to the needed people. Thank you.